I've always loved to teach. That was actually the first thing that I thought I would do as a child. I wanted to be a teacher. But then, as time went on, I realized I had a love for science and then a love for helping people and medicine. I was always intrigued about what happened within our bodies, how things worked in the world, and it just was a great fit for me. And that's why I went ahead, went to medical school, and completed my pediatric residency, and I haven't looked back. I love the field. So it's just a great fit as I'm able to merge the love of teaching, passion for teaching as well, making sure topics are broken down so that people can really understand things in a manageable way. This meshing of teaching and loving medicine is great for me. I also love to empower the patients and parents that I see, and in addition, helping others that are behind me that are trying to be a physician. Case of a fever in a 2-week-old female. This is such a very important topic, so it would be great if we can really grasp hold of the information that we're going to be going through. So this is the case of a 2-week-old female with fever. Of course, that's the mom's chief complaint. She comes rushing into the emergency room. She looks frazzled and she's holding this infant in her arms. She says to the nurse, my baby felt warm and I went ahead and took a temperature. I did it rectally to make sure that it was accurate, and that was about 3 hours ago. And when I did that, I found that her temperature was 100.7. Looks like she's been less active than usual. She doesn't really have any medical history of concern, but she does sometimes occasionally spit up quite a bit. I don't know of anything else except I think some of her siblings were a little bit sick recently. They had some respiratory illness. Otherwise, nothing else that I can think of. She hasn't had any diarrhea. Her urine output has just been a little bit different, but nothing of note. She hasn't had any rash or anything that I know of. I've also noticed that normally she loves to be held. She doesn't really want to be bothered. She's just crying a lot more than usual. And it just seems like I can't really console her. She was born at 38 weeks and she had a normal delivery. And as far as I know, they didn't find anything wrong with her. And I haven't had any medical issues either. Now, as we go further along in the case, the nurse is taking her vitals. The physician comes in and he's going to do his exam. Vitals are temp of 100.9. Her heart rate is at 170, respirations 35, her O2 sat 99% on room here. Her HENT exam shows nothing very remarkable. It looks like she doesn't have any obvious findings there. Anterior fontanelle is soft, open, and flat, non-bulging. Her eyes are clear. She has a normal red reflex. Laterally, tympanic membranes with positive light reflex. Her nose is clear. Her neck is supple. There's nothing really obvious there. And her mucous membranes are moist. Her lungs are clear. Her abdomen is soft. Doesn't look like she's in any discomfort when the physician palpates. Her heart rate is normal. She's well perfused. She doesn't have any rash. She has normal range of motion. Grossly intact. She does look like she's a little bit uncomfortable and she's crying every now and then. She's not really settling down. Besides that, nothing else on her physical exam. Okay, guys, now that you have that information, what are some things that they could potentially ask you about a case like this? Many times they're going to want you to know what kind of illnesses can present in certain age groups. And what's your initial management and steps that you might want to take? And then, of course, what kind of treatment? All right, what kind of things are we thinking about? What could it be that could be causing a fever in this age group, which of course is the neonatal age group, specifically 0 to 28 days. So this is a high risk group. What should we be thinking about? So bacterial infections, things such as meningitis, that could be a problem, serious problem. UTIs, a pneumonia, maybe. She has some siblings with respiratory illness. Bacteremia or sepsis, of course, that could be a definite possibility. and of course a dangerous one. So we got to be thinking fast here. If we were the ER physician taking care of her, we want to be running down certain things so that we can help her quickly. The faster we get the knowledge about what to do, the faster we get things going, we can save a life here. Viral infections, of course, you can have viral meningitis, common viral illnesses, and of course, what kind of contacts has she had or exposure? Or is that temperature just a fluctuation? Is it just a temperature change from her environment or from heavy clothing or bundling? Maybe, but at the same time, we've had 2 recorded elevated temperatures and they were rectal. So I would definitely use that as a trustworthy measurement because we repeated it and it's still elevated. An infant, by definition, a fever is 100.4 and above. So keep that in mind. Now some insights, some clinical pearls that you want to also keep within the forefront. A fever in a neonate is always a medical emergency until proven otherwise. We talked about the definition of fever, so please make sure you're aware of that and always take an accurate temperature when you have a neonate. A good indicator to the severity of illness is how is this infant acting? Is she easily consoled? Does she look like she's very irritable and fussy? Oftentimes you may see the keyword fussy in some of the questions, and that can also give you an indication that this is just not a regular passing illness. This is something that we have to do something for. Infants can look just fine on the outside, but inside they can have something raging that needs to be treated immediately. So don't be fooled by exterior appearances. If you have an infant with a fever, always consider doing a sepsis workup. And we'll go into some of those labs a little bit later, but they should include a good full workup. It could include also some imaging if there's a need for that. For example, if she had respiratory symptoms, you might want to consider things like a chest x-ray. So keep thinking about the information you were given in the history, very important. Speaking of history, maternal history. If mom had any illnesses, maternal infections that could have been transmitted, you also have to think about late onset sepsis because it can still present even at this age and it can be fatal. Okay, so let's think back through our case. What are some clues that can help us to answer this question? Remember, she had repeat abnormal temperature elevations at home and in the ER. She hasn't really been easy to console, which is unusual, like I mentioned. She did have some exposure to relatives with potential viral illnesses, but we shouldn't assume that may be the answer because things can be quite different in an infant that doesn't present like an older child or an adult. She also has no respiratory symptoms, so it's less likely. Okay, here's her test results. So she had a CBC with diff. Her white blood cell count shows at about 15,000. All the other parameters are normal. Her urinalysis shows 2+ leukocytes and moderate bacteria. Her CRP is normal, which is a generalized inflammatory marker, but a good one that we often use when we want to rule out a bacterial causation or a sepsis picture. Her blood culture was done and it's pending. Her BMP is normal. She has no electrolyte abnormalities. And they did do a CSF culture, which would include a spinal tap, and so far, so good. So now, what do you want to do? I oftentimes see the question being asked, what is your initial management? What are my first steps of action? So immediately, of course, the labs that we discussed, and then she needs to be immediately admitted for inpatient management and started on empiric antibiotics. And of course, now in the question, they may have some of the answers with the potential of all being right, but which one would be your first step in the action? So you would have to triage, which one should I do first? You may see multiple answers that are right, but which one is the best one, or the initial step and course of action that you should take? Now, what can we assess? What do we know? In those labs, there was one thing that was pretty off, and that was within her urinalysis. She had 2+ leukocytes, which means she had white blood cells in her urine. Urine is not to have that. Normally, the urine is a sterile place. It doesn't have bacteria in there. So she had white blood cells and she had bacteria. She had inflammation there and abnormal pathogens. Of course, as I mentioned, a fever in a neonate is a medical emergency until otherwise proven that it's something else. So a careful and detailed history is very important, as we had already obtained. In addition, since she is a neonate, she has not had her full set of vaccines to help protect her against certain bacterial infections. So it's also important to think about this when you're trying to make a plan about what you should use to help treat what you have now found, or what should I use in a neonate with a fever and I don't have an obvious reason at the moment. I'm going to have to go ahead and treat empirically. So based on her age, not being fully immunized, what should I be choosing? So that could also be a potential question that they had asked you about. You should also always consider the urinary tract in infants that present with a fever, as they are not going to present as an older child would, with burning and urinary frequency and abdominal pain. They may not, or they may have discomfort, but they don't know how to express it to you. So always keep in mind, if you have a fever in an infant and it's not too much obvious other symptoms, always screen the urine to make sure. Urinary tract infections are diagnosed when you have significant bacteria and a single pathogen in the urinalysis. And of course, the key would be to find the pathogen on the urine culture. By definition, it should have 50,000 or more organisms. UTIs of note are second in line to respiratory illnesses in infants. So it's something that you definitely need to consider, and it can be a source of morbidity. The most common pathogen that we see usually is E. coli. We have others too, such as Klebsiella, but usually E. coli is the top. And of course, your antibiotics need to be chosen by the local resistance pattern in your area, because it may be different from state to state. And if you don't know, if you're in a hospital setting, or if you have an infectious disease specialist that you can go ahead and pick their brain, ask them so that you are aware and you can choose the right choice. Sometimes, depending on the case, the kidneys can be quite affected. So it's very important whenever you have an infant with a first febrile UTI to go ahead and get a kidney ultrasound. So treatment in detail, we're going to hospitalize this patient. We already did our labs, and we're going to start our empiric antibiotics as soon as possible. Most commonly, the antibiotic of choice would be something like an ampicillin plus a cephalosporin class. In general, if you didn't have the source still, but you had a fever and you want to treat empirically, then you would still do ampicillin or something in the cephalosporin class. And then if you suspect that there's a history of herpes in the mom, you may have to go ahead and add a cyclovir, because you could also have a viral meningitis. So what happened with our patient? After being started on empiric antibiotics, her temperature normalized within about 24 hours, intake and mood improved. Urine cultures came back with greater than 50,000 CFUs of E. coli, and it was sensitive to ceftriaxone. Within 3 days, she was back to herself, feeling fine, and inpatient team switched her over to oral antibiotics, and that would, of course, be continued to complete 10 days. And then she would need follow-up with her pediatric provider. In her case, her kidney ultrasound came back normal, so she didn't need any further urology follow-up. So what are some things to take away? Never forget that a fever in a neonate can be a medical emergency, and always consider the urinary tract system as the potential source of illness. because you may not see specific symptoms on the outside. All right, you guys, I hope that you grasped everything, remembering those main points.